I'm glad we're having another FDRS conference finally, and I'd like to thank the committee for allowing me to present my thoughts on velvet glove or iron fist. What is the best surgical approach for lipedema? We have a lot to cover, so let's get started. My disclosures include that I'm a speaker for Abbott Nutrition and a consultant for Invasics and BTL Aesthetics. Well, let's start with a definition. Cognitive dissonance is the state of having inconsistent thoughts, beliefs, or attitudes, especially as relating to behavioral decisions and attitude changes. If you find yourself feeling a little bit uncomfortable during this talk, it might be because your subconscious is challenging what you think to be true, and that's a good thing. So let's start with some pictures of what I will be addressing during the talk. So let's start with an easy one. What's this? And what's this? So this is a little bit more difficult. What's going on here? And what the heck is this a picture of? This slide is a little bit more graphic, and every surgeon in the room probably just got a little bit nauseated looking at it. And what's this a picture of? Now let's talk a little bit about my personal philosophy for lipedema treatment. So I believe lipedema is best treated by getting rid of as much of the diseased tissue as you can the first time around in any anatomic area, as long as it's safe to do so. So I've taken the term wipe out liposuction and shortened it to the more fun term wipo-lipo. And my patients know it involves rigid preoperative, intraoperative, and postoperative protocols. And I want other surgeons to be able to use this term. So if you are doing something similar to what I'm doing and you want to use it, please contact me and I'll personally approve of you using it. Now the next couple slides are going to talk a little bit more about what I do. Some of the videos are a bit graphic, so if you do have a bit of a queasy stomach, then I recommend averting your eyes.
Okay, so here we have a young female with stage 2 lipedema, and we've done liposuction of her arms and her thighs. And when we're all done, I want to see zero fat. So I've thoroughly evacuated the diseased fat. And so this is wipe out liposuction or wipo-lipo. It's basically skin directly on top of the muscle. So we'll just go ahead, we'll put the compression garment on. She'll spend 2 nights in the hospital for IV hydration and assistance with ambulating. And I look forward to seeing her when she's all healed, the swelling's gone down. We can now see her beautiful legs. There we go. So that is a rock hard piece of fat that's pretty typical for lipedema. That's what I try to aggressively break up with liposuction so that I can pop them out at the end of the case and create a nice smooth contour.
So using these protocols, we can remove large amounts of fat with large volume liposuction. And so this is my personal record, 33.3 pounds removed. And here's the beautiful fat. So there's a bit of a controversy regarding the best way to treat lipedema, whether you should treat it gently with, quote, lymph-sparing liposuction, close quote, with a velvet glove, or more aggressively with an iron fist where lymphatic sparing doesn't matter. And my philosophy is to use that iron fist, and we'll talk about why. So Exhibit 1 is simply my experience. And I looked at large volume liposuction cases from October 2019 when I started my own practice until July 2021. There were 26 patients undergoing 41 surgeries. Average age was 45 years old. Most of my patients were female, not surprising. And mean BMI, body mass index, was about 40. In terms of procedures, the mean fat removed was 10.4 liters, all the way up to 16.6 liters, which translates to fat weight removed of 20.9 pounds with a range of 11.5 pounds up to 33.3 pounds. So these are the big surgeries that I do. In terms of complications, there were some minor complications. About 15% of my patients had infections requiring oral antibiotics, and about 27% of my patients had seromas or fluid collections requiring drainage. Moderate complications were more rare. None of my patients had infections requiring IV antibiotics, and 3 out of the 41 surgeries, or 7.3%, had wounds requiring wound care. None of my patients had severe complications, which I categorized as blood transfusions or DVTs and PEs. And most importantly, none of my patients had persistent significant lymphedema. It just didn't happen. One patient had one foot that went up by 1 shoe size, so that was relatively annoying, but nobody had significant lymphedema afterwards. That's pretty important. So that was just my experience, but what does the literature show? So here's Exhibit 2. This is a study done in Germany on cadavers that died about 20 hours prior. The group injected blue dye into the lymphatics of the foot, and then they did liposuction either in the same direction as the extremity, or parallel, or at a 90-degree angle, or across the extremity, which is transverse. They then looked at the fluid that was sucked out to evaluate for blue fluid indicating lymphatic damage, and also dissected the area to actually see if they could find visible damage to the lymphatics. And what they found is that without tumescent, meaning when you don't put fluid in the extremity before you do liposuction, if you did liposuction in the transverse direction or across the extremity, there was some pretty significant damage to the lymphatics. About half had moderate injury and half had severe injury. And this is one of the studies that people cite when they say that liposuction causes damage to the lymphatics. Interestingly, though, when the cannula went in a parallel direction or the same direction as the extremity, this is without tumescent, there was no injury in the vast majority of the extremities and just moderate injury in 4. Now, when you do liposuction in the extremities, most of the passes are parallel or in the same direction as the extremity anyways. So there really isn't that much damage when you're doing it parallel, even without tumescent. So to summarize, without tumescent, doing liposuction in the transverse direction is bad, and when you do it in a parallel direction, it's okay. So that same group from Germany then repeated the experiment. This time they added tumescent before they did liposuction, or they added fluid to the extremity before they did their work. This also involved cadavers that died about 24 hours prior, and using cadavers is important. We'll talk about that. They injected the blue dye, they did liposuction either in the same direction as the extremity or across the extremity, and they similarly evaluated the aspirate for blue fluid and dissected to see the damaged lymphatics. And here's what they found this time. Just as before, without tumescent, when you went in the transverse direction or across the extremity, you had moderate or severe injury to the lymphatics. And then when you went parallel, you had much less injury. But interestingly, when you added tumescent, it didn't matter which way you went. You could go parallel, you could go transversely. There was no severe injury in any of those cases, and most were no injury or moderate injury. So just adding tumescent was protective. How do we do liposuction currently? We use tumescent. So as long as you use tumescent, it is essentially lymphatic sparing. It doesn't matter how you do it. So Exhibit 3 is that lymphatics are redundant. And so this is a street map of Chicago, and if streets are blocked or damaged, you can be rerouted to get to your destination. And so this basically happens in the extremities as well with the lymphatics. If some of the lymphatics are damaged or injured, there are enough lymphatics that are going to be working. It's redundant enough where it's not going to cause significant functional problems with the lymphatic flow. And also, the study was done in cadavers, and in live people, the lymphatics can heal. And how do we know that? Well, here's the next exhibit. So how do we know that lymphatics can heal? Well, here's Exhibit 4. And this is somebody painting a picture, but what's really going on here? Who's painting it? So the person doing the painting is Sheila Adventino, the first U.S. female to undergo bilateral hand transplants. Now, she lost her hands to acute septic shock and then received hand transplants. So at one point, her surgical team in Pittsburgh was preparing the hands, and the patient was in New Jersey. So she had to board a flight from New Jersey to get to Pittsburgh for the transplant. So I'm quite sure that all of the lymphatics were damaged. Now, when you do a hand transplant, you connect the bones, you connect the blood vessels, you connect the nerves, and you connect the tendons and muscles. You don't connect the lymphatics. And so she did not have significant swelling afterwards. Those lymphatics healed on their own. So this slide's a little bit graphic, so if you are a little sensitive, you might want to look away. But Exhibit 5 is that surgeons can't knowingly miss the lymphatics. This is a picture of small bowel with multiple injuries from a liposuction cannula. This particular surgeon didn't know they were even hitting the small intestine. You really don't know exactly where that end of the cannula is. So any surgeon that says that they can knowingly miss the lymphatics is being a little bit disingenuous. You really don't know where that cannula is because this is a completely blind procedure. Well, what about being gentle? Well, Exhibit 6 is that fat can turn into bone. You know those nodules that I sometimes pop out? Well, one was really firm and I sent it off to pathology and it came back as osseous metaplasia. The body was literally turning fat into bone. You can't be gentle with this. You've got to be aggressive and break it up to properly treat the disease. Exhibit 7 is just terminology. So saying that you went skydiving is the same as somebody saying skydiving with a parachute. Now you don't say skydiving with a parachute because a parachute is just implied. So it's the same thing with liposuction. Lymphatic sparing liposuction is the exact same as just saying liposuction based on our current techniques, so it's unnecessary to say that. So Exhibit 8 is a picture of the Earth, and it's round. And for the vast majority of human history, people thought that the Earth was flat. And ultimately, we knew better. And so I'm hoping that similarly, people will change their opinions on lymphatic sparing liposuction. So in conclusion, I think it's best to treat lipedema with an iron fist. You can be aggressive. And don't worry about the lymphatics with current liposuction techniques. So the term lymphatic sparing liposuction is a redundant term and unnecessary to say. Here's my contact information if you have any thoughts, questions, or concerns. And thank you very much once again for allowing me to present. I hope you're having a wonderful conference.
I just wanna love you.